Go.
Come in.
Hi, my name is Paige. I'll be your student nurse today. I'm going to close the door for privacy and wash my hands. Do you have any allergies?
Nope.
Are you in any pain today?
No.
Okay. Can I see your wristband? What is your full name and date of birth, please?
Rebecca Hooker, May 21st, 93.
Okay. And do you know the date today?
It's the 5th.
All right. The patient appears to be her stated age. She's alert and oriented ×3. There's no odor, no obvious signs of illness, and she appears to be groomed. I'm going to start your assessment. I'm going to start in your hair. Make sure there's no lice or lesions. There does not appear to be any. Okay, and now I'm going to just touch your face. The face is warm and dry to touch. The color is evenly distributed. Okay. If you could just follow the tip of my pen light, please. All right, and there's accommodation. If you could look straight ahead, please. Okay. And the pupils constrict consensually. I'm going to check your conjunctiva. Make sure that it is pink and moist, which it is. Okay, and the pupils are round. Okay, now I'm going to check your buccal mucosa. Just open your mouth, and it's pink and moist. Can you stick out your tongue for me? Okay, that's cranial nerve 12, and say ah.
Ah.
That's cranial nerve 10. The uvula raises, and the tonsils are a 1+. The teeth are intact, and the gums are also intact and not puffy or bleeding. Okay, and I'm going to check your carotid arteries, one at a time. Alright, and there are 2+ bilaterally. Now I'm going to auscultate for any signs of bruits, which are whooshing sounds. With the bell of my stethoscope. If you could take a deep breath in and let it out and hold it. And again. And there are no signs of bruits. Okay. I'm going to move on down your arms. The skin is warm and dry to touch. Stop and take your brachial pulses, which are 2+ bilaterally. And then your radial pulses, which are also a 2+ bilaterally. And there's no obvious signs of, there's no lesions or any color that is cause for any concern. There's no clubbing, and the capillary refill is immediate. Okay, and can you pull down on my hands for me? Okay, she has arm strength. And next I'm going to listen to your lung sounds. Okay, I'm going to do 8 in the front, 2 on the side, 8 in the back, 2 on the side. So every time my stethoscope touches you, if you could just take a deep breath. Okay. And there were vascular breath sounds and no adventitious sounds in the front. And while I'm coming to the back, I'm going to check that the anterior-posterior diameter is 2 to 1, which it is. Okay, same thing, just a deep breath every time. And there are vascular sounds on the back too. No adventitious sounds. Okay, I'm going to check your costovertebral angle. So let me know if there's any tenderness.
No. No.
Okay, and if you could just bend over while I check your spine. Her spine is straight. There's no signs of kyphosis or scoliosis. Okay, now I'm going to listen to your heart sound. Okay, I'm going to listen to your second right intercostal space, and that is your aortic. And your second left is pulmonic. third is herbs. Fourth is tricuspid. And then fifth intercostal space midclavicular is the mitral or the apical heart rate, which I will listen to for 60 seconds. Okay, and S1 is heard louder at the bottom and S2 is heard louder at the top. Do you have to use the restroom?
Nope.
Nope. Okay, would you lay down for me? And do you mind if I pull up your shirt?
That's fine.
I'm inspecting to make sure that the stomach is flat, that the abdomen is flat, and that it's not scaphoid. And I notice a tattoo on the upper left, and the belly button is midline and inverted, and there's no lesions, and the color distribution is even. I'm going to start auscultating in the right lower quadrant, and that's where the ileocecal valve is. Okay, and vowel sounds are present and active. Now I am going to percuss. And tympany was heard except over the liver where it was dull. And now I'm going to palpate with light palpations, 1 to 2 centimeters. And I'm palpating for any masses. In the right lower quadrant should be the appendix. The right upper should be the liver. The left upper is the spleen. And the left lower is the sigmoid colon. Okay, and I did not feel any masses. Okay, if you could just sit up for me. Okay, now I'm going to feel down your legs. And they're still warm and dry to touch. And your popliteal pulses are 2+ bilaterally. And then your posterior tibial are 2+ bilaterally. And dorsalis pedis are 2+ bilaterally. I'm going to check for edema around the ankles. There's none present on either leg. And now I'm going to do Babinski's. I'm going to start at the heel, make a J towards the toe, and curling of the toes is expected. Okay. Now could you just stand up for me? We're going to do Romberg's for 20 seconds. If you just close your eyes. Okay. And there's no swaying. She had a balance. And now could you just walk to that side of the room for me? Alright. And on the way back, walk heel to toe. Okay, and that completes the head to toe.